First element of like clinical practice is assessment. So understanding clients' concerns through interview, observation, and psychological. When we talk about psychological assessment, so many times we uh, understand like using we refer that term to for using psychological testing. It is not only psychological testing. Psychological testing is one part, and, apart from that, there are other things also, like how to interview the client, what are the from where you will get all the information like previous treatment histories, history from parents, history from a spouse, everything, your observation and all. And if needed, then we also go for psychological testing. So psychological testing is like very structured thing. So usually we learn and we apply those things. But mm, learning psychological tests or understanding where to apply, how to report, when to use, that is a different story. So sometimes people what they do is like they do test. I have seen people, so they are doing testing and based on that they are making diagnosis. So it is not about making diagnosis. They can help to make like help you to take decision for like making diagnosis, but it is not for psychological diagnosis or some certain thing. It is your clinical skills that you learn is basically your skill, not psychological test. Psychological test is a part of your practice, not you cannot be dependent on that totally. So they are helping tool, you can say. And then diagnosis, like usually when we are dealing with clinical psychology, so usually we make diagnosis. Because in counseling, sometime there is no need, because there are certain like issues, adjustment issues, or some relationship issues that happens in everybody's life. So there is no need to make certain kind of diagnosis and labeling the person. But for communication and everything, diagnosis is required. So in clinical settings, it is like required to make diagnosis, or we use to make like diagnosis. But in counseling, like we may not use that kind of labeling. Then intervention, that is applying evidence-based therapeutic techniques to reduce distress and improve functioning. So that is the purpose, is to improve the life of person. So and that should be evidence-based. Sometimes what happens, what is working with me, I am applying that thing, or whatever I know, we are applying that thing. So we are not like we are not doing trial and error. You should know that what kind of treatment is like proven uh, beneficial in certain conditions, then only you can use that, because client is giving you the, you can say, the fee, and your professional and ethical responsibility is like you deliver the like evidence-based therapies or counseling, right? Then prevention and promotion, supporting mental health well-being and preventing future psychological disease. So it is not only about treating, and when you are treating, also you also focus on prevention so that that problem should not occur. Then evaluation and then monitoring the progress in a like um, proper way, if the whatever you are doing, it is effective or not. If it is not, just like any medications, when you go to doctor and they are prescribing you certain kind of medications and it is not working after 1 week or certain time, then they change it. So similarly you can also do that, because that is about monitoring progress, modifying treatment as and when required or needed.